Bismillahirrahmanirrahim. The next topic in vascular pathology is angiosarcoma. So angiosarcoma is malignant tumor which is derived from the endothelial cells lining the blood vessels. The most common site of angiosarcoma is skin, and almost 60% of the cases involve the skin of head and neck. Apart from the skin, internal body organs are also involved, which include liver, bone, lungs, spleen, and in rare cases heart and kidney are also involved. The risk factors for angiosarcoma include exposure to certain carcinogens such as polyvinyl chloride or PVC, certain pesticides that include arsenic, and a radio dye which was used earlier known as thorotrast constitute the most common carcinogens for angiosarcoma. The other risk factors include exposure to radiations, and long-standing lymphedema can also result in angiosarcoma. The radical mastectomy involves the removal of axillary lymph nodes, and the angiosarcoma develops on the same side of removal of the lymph nodes. The radical mastectomy can also result in prolonged lymphedema and hence constitute a major risk factor for angiosarcoma. Coming on towards the pathogenesis, the risk factors of angiosarcoma result in mutations in tumor suppressor genes and proto-oncogenes. The tumor suppressor gene is p53, which normally inhibits the cell growth and keeps the excessive cell growth under check. So there is a loss of function in p53 gene, hence resulting in a loss of check against the excessive growth. So the ultimate result is the increased cell growth, and moreover the proto-oncogenes include mutations in tyrosine kinase receptor genes and vascular endothelial growth factor receptor genes. The tyrosine kinase receptor promotes the growth, and vascular endothelial growth factor receptors also result in excessive growth and proliferation of vascular endothelial cells. So there is gain of function mutation in the proto-oncogenes. So their initial function of growth and proliferation gets enhanced, and hence there is an uncontrolled increased cell growth and proliferation. This unchecked and excessive cell growth ultimately results in the formation of tumor or angiosarcoma. Certain other genes such as KDR gene mutation is also found in the angiosarcoma involving the breast skin. KDR genes encode the receptors for vascular endothelial growth factors. Moreover, in the radiations-induced angiosarcoma, mutations in CMYC gene is also found. MYC gene is a proto-oncogene. Moving on towards the morphology, the angiosarcoma involving the skin are presented by the lesions which are well demarcated, and they might be either in the patch form, it might be a plaque or a nodule. In either case, they are all well demarcated from the surrounding skin, as you can see here. So this here is a patch. As you can see, it is perfectly flat with the skin. These are the plaques which are elevated and almost less than 1 centimeter in size, and these are the nodules which are elevated and they are more than 1 centimeter in size. The color might be reddish to bluish, and they become large and may acquire a fleshy appearance. The color might also turn into grayish white to reddish, and in advanced cases these nodules can also get ulcerated. Moreover, the cut section reveals frequent hemorrhagic areas, and the tumors are also consistent with focal necrotic areas. The first point to explain in the histology is the pattern. So these tumors form the papilla or nests of the cells, forming poorly architectured vascular channels. This growth pattern is usually seen with the well-differentiated cells to moderately differentiated cells. As you can see in this histological picture, there are moderately differentiated endothelial cells and they are forming vascular channels. Moreover, the spindle cells form solid growth pattern. The solid growth pattern is associated with poor prognosis of the disease. The second feature to explain is the cell characters. The angiosarcoma is a diverse tumor which may contain the well-differentiated to poorly differentiated or completely undifferentiated cells. The well-differentiated cells totally resemble the endothelial cells, and the tumor might also contain poorly differentiated plump or anaplastic cells. The plump cells are round, having central nuclei. In certain cases, spindle cells are also present, which are elongated cells. So whether they are well differentiated or they are poorly differentiated anaplastic cells or they are spindle cells, all are actually derived from the endothelial cells. This is confirmed on the immunohistochemical staining of the cells for CD31 and von Willebrand factor. The third point is about the focal necrosis, which is a hallmark of malignancy, and hence it is present in angiosarcoma. And the fourth point is mitotic bodies, which are always present in the malignant tumor. Coming on towards the clinical features, the angiosarcoma involving the skin is characterized by the formation of certain lesions on the skin, and these lesions might be a patch, plaque, or nodules. These lesions might be reddish to bluish in color due to presence of the blood, and in advanced cases, these lesions might also get ulcerated since they are easy to bruise and bleed. The disease involving the liver presents with the right upper quadrant pain, jaundice, and fatigue, whereas the angiosarcoma in the lungs present as pleural effusion, excessive bouts of cough, and difficulty in breathing. Angiosarcoma is a very aggressive tumor and metastasizes to lungs, liver, bones, and even lymph nodes. The diagnosis is established on the clinical signs along with the radiological studies such as MRI and CT scan to establish the full extent of the disease. And the gold standard for diagnosis of angiosarcoma is histological study of the biopsy. The treatment of angiosarcoma is surgical excision of the tumor, and moreover radiotherapy and chemotherapy can also be utilized according to the needs of the patient. The angiosarcomas are extremely aggressive tumors and the 5-year survival rate is less than 30%. So this brings us to the end of discussion about angiosarcoma. If you have any questions, do let us know in the comment section.